It is certainly a good day here on Welcome to Our Community as I get a chance to welcome back a friend, Felicia Anderson, who is a licensed clinical social worker with Gateway Service Board. Thank you so much for being here.
Thank you for always having me, Ms. Dime.
Well, we were excited about, I shouldn't say the word excited, but I felt the need that we had to bring you on because so much has happened since you were last here. Even this year alone, starting in July, you know, mass shootings, not only around the country, but now in our own neighborhood. And so many things going on. And now with the government shutdown, people are dealing with a lot.
It's so much always, like we were mentioning earlier, that every time I come, it's always something, right? Yeah. And October is a good time to kind of highlight that. So there's two big things that are going on when it comes to mental health and what you can take in consideration when dealing with your own. The first full week of October is National Mental Illness Week. And so that time is to really explore, bring awareness to mental disorders, right? And we all have mental health, but some individuals may have mental disorders in which they experience the world just a little bit differently than we all do. And then October the 10th is World Mental Health Day. It's so many mental health days. So it's World Mental Health Day on October the 10th. So taking those two things into consideration, when we are experiencing all the things that are going on, like you said, governmental shutdown, and we are having changes in our economy and just the world in general, how are we consuming that information? How are we taking care of ourselves? And so October, I strongly encourage everyone to take a pause and look how that's impacting you. And some things you can do is just a quick, like maybe depression screener. Things you can look for is mood changes. Has your mood changed drastically, right? You being irritable a little bit more often, or cranky or snappy. Something else you may want to consider is how is your sleep? Are you sleeping a lot? Are you not sleeping enough? How are you engaging with your family? And if there's any signs or thoughts of suicide, we definitely want to take those seriously.
So how do we know when it is too much for us to handle on our own?
You know when it's too much when, one, you're having those thoughts of suicide, when you have thoughts of hopelessness, when you are not able to carry out daily functioning. So some individuals, they may have those, like I said, suicidal thoughts, or I may have not gone that far, but they just cannot function daily. They are missing a lot of work. They're not showing up in school. They are not sustaining positive relationships with their friends and family, and they just can't carry on those daily tasks that make their life whole.
So besides going to a therapist, what are some things that we could do on our own that can help us cope with these situations? You said, you know, don't be bombarded with all of the 24-hour news and social media that may dwell on some of the bad things that are happening.
Yeah, and I hate to say that while I'm talking on the news, right? But we just want to be mindful of our media exposure. We want to connect ourselves to strong support. So if we have family and friends that are anchors in our life, lean on them during these times. Our food, the food that we digest, that can play a big part because your health impacts your mental wellness, right? When you are sick, you're not happy, you're not in a good mood, right? And so what can we do to prevent some illnesses? One thing to consider also is the sun is coming out, you know, a little bit less. It's going to get darker sooner. And so there's this thing called seasonal affective depression or disorder, is when we get less sun and it impacts our mood. And so what can we do? Can we make sure that on those sunny days we're going out, that we have lamps and lights, that we're taking vitamin D, and again, that we are connecting with our social supports, whether that's church, work, friends, family, colleagues, whoever.
We sometimes talk about the need for counselors and such. Some people may never listen to this because they think they can't afford it, but there are some ways around some of those fees depending on where we work, how we live our lives.
Yes, absolutely. So first and foremost, if you are going through a crisis, 988. Call 988. That is a free resource that can connect you to crisis support. And then here in Coastal Georgia, you know, I got to shout out our home team, Gateway Community Service Board. You can visit our website at gatewaycsb.org. We are the safety net organization for behavioral health services. And then there's a plethora of different mental health services. And also, if you are employed, please contact your employee assistance program. You may need to contact HR or whatnot, but there are definitely resources and free resources at that you can get the support you need.
Well, we are so excited to hear about those free resources because that at
Yes.
least could get people started. Because isn't it like maybe 6 sessions or so that
Yeah.
might be free depending on where you were?
It just depends. It varies. Sometimes it may be 4 to 10. It just depends on which work. And a great thing, and I'm just going to kind of jump into this because we're always sharing resources. In November, we will be having our big Break the Stigma car show over at Tanger Outlets. And at that car show, we're highlighting all the cool cars, right, and vehicles and motorcycles, but also there will be plenty of vendors that are offering free mental health resources. And so if you want to connect to a therapist or agency, please visit the Gateway table, but there will be other vendors that can share those resources as well.
That is really wonderful. Well, we know that you are always active in our community, helping people with mental health, especially through the school system with some of the younger
Yes,
people.
We serve over 15 schools in coastal Georgia where we provide direct mental health services. So we have a therapist, and Sheree McKenzie, she is our fabulous program manager over that program. But we have therapists that work directly in the school, and they provide those therapy mental health services that you will get at an outpatient clinic setting. And so we're very grateful that we have partnered with 3 of our local school systems to provide that much needed service.
Well, tell me, you were a part of that as well. What is
Yeah.
that like knowing that you're going in and here these young people are struggling, but by the time they go through your program, you make those connections with them, you could see a big difference in them, more positive outview for them?
By far one of the most rewarding experiences. My personal motto has always been, I want to be the adult I needed when I was younger. And so when you are able to provide that direct one-on-one care to children and adolescents that need it the most, it's very impactful. And it helps us as a community as a whole, so they have the tools as they grow to support others.
Well, since you were here, there's also been a big recognition for you in the work that you do when it comes to mental health care.
Yes, yes. So I have recently been honored as Georgia, a statewide recognition, Georgia Trends Magazine 40 Under 40. And so of the 2025 class, so I'm super excited not only to highlight my professional accomplishment, but it really highlights our region here at coastal Georgia on us advancing behavioral health services to everyone that need it the most. So super excited.
Well, congratulations.
Thank you, Ms. Don. I
A
appreciate it.
recognition well deserved.